Good morning. Thank you so much for joining us bright and early on this Tuesday morning, and welcome to this informational town hall for the UC Davis Health Aging Initiative. I'm Rebecca Bedeau. I'll be serving somewhat as your MC this morning, and we really appreciate you taking time out of your busy schedules to learn more about how UC Davis Health is developing a world-class healthcare program for older adults. For the next half hour, we will share with you the vision for the Aging Initiative, progress already underway, and how you and your team can get involved. You will hear from the initiative's leaders, School of Medicine Dean Allison Brashear and School of Nursing Dean Stephen Kavanaugh. If at any time you have a question for our leaders, please ask it in the chat. You will see in the chat there is a person that's labeled Ask Questions Here, and that will be the best way to get your questions asked this morning. We will have some time at the end for some Q&A, and if we don't get to your questions, we will follow up via email. I want to remind you we are recording this town hall this morning so that we can share it with you afterward, and you can share it with anyone who is unable to be here. So I think we can advance the slide one, and it kind of shows a little bit of that's our agenda for today. So I'd like to start with Dean Brashear. Good morning, Dean Brashear. Can you share with us why, as a health system, we're focusing on older adults at this time?
So one of the things that is so critical is making sure that our older adults are well taken care for. And the Sacramento community has a significant number of residents over the age of 65. We also know that older adults have needs that we don't necessarily meet when, for example, coming to the emergency room or the hospital. And so we are really designing a program around all of the missions of the School of Medicine and School of Nursing to take care of our older adults. I bet that the people listening in didn't realize that over 14,000, almost 15,000 come to the emergency room every year. And when an older adult comes to the emergency room, much like we might take care of children, we have an emergency room for children, there's special things that older adults need. They have certain issues, medications, their care at home, who they live with, do they understand their medications, all of those things that come when you come to an emergency room. Moreover, we have a diverse population, and in Sacramento and Northern California, we have individuals that have other needs that involve the community. For example, we have older adults that are unsheltered. So we are designing a program that is specific for our older adults. And one of the things that I'm so happy with is that we're partnering with the School of Nursing, because really this is a multifaceted program. It's having a front door for our clinical program, but really builds upon the excellent research that we have both in the School of Nursing and School of Medicine. And we're working to educate the next generation of providers so that they look at things through the lens of our older adults, and that we're providing the older adults the excellent care that is really specifically for their needs.
So good statistics there. Dean Kavanaugh, let me bring you in. With those facts in mind, what is our vision at UC Davis Health to care for this population?
Well, good morning. Thank you for that question. Good morning, everybody. After a lot of work, we did create a vision to create the healthiest and highest functioning older adult populations in Northern California due to care, research, and innovation at UC Davis Health. And that's really, really important for four important things. We're really working very, very hard to optimize the quality of care of older people. This is central to everything we do. It's all about the quality of care. But equally as important, as you'll hear a little later on, is the important about the support we give to caregivers. We really are looking at this as not simply an older person, but the environment in which they come from. We also want to leverage the great strengths of our academic medical center. That's not just the fantastic care, the research we can offer, but also the teaching opportunities. We do need to think about the next generation of clinicians that we are bringing forward. This also comes at a really important time, and I think there are 3 or 4 things I'd really like to tell you about. First, this comes at a time of cultural shift. UC Davis really is looking to work with its older population, its communities in a different way, substantially different way, right across the health system. We want to deliver world-class care to everyone that comes in. We're going to be very thoughtful and very specific about this. We also are developing a whole new approach to ambulatory care. And as Alison, Dr. Bashir was saying, this collaboration about co-creating an opportunity with physicians, nurses, physician assistants, and others is really at the center of everything we do. And of course, we're trying to pull in the amazing array of researchers, both and practitioners, of course, not just on this campus, but around the whole of UC Davis Health.
So this may be the first time that many of our attendees are hearing about this initiative today, but who has been involved so far? What does the organizational structure look like of the initiative? Because I know people have been very busy.
They have, and I think there are approaches from both medicine, from both nursing, from a whole range of folks. And as you'll see in front of you, the organization, I know there's a lot of words there, but an executive committee that has involved clinicians, practitioners, those things that know how to make things really work. I think the important takeaway from this is that, as Dr. Bashir has said, this is a multidisciplinary effort. You'll see leading these clinics from an education perspective, from a research perspective, from a care delivery, and you'll hear Terry Harvath at the Harvath speak in a few moments, but also coordinating this, and it's taken a lot of work, a great number of people involved at this point. But we also have a number of very, very specific things that we want to pull together here. We do want to have very concrete examples of performance to talk about. We do want to reduce lengths. We do want to improve care. We know we have to look after the sickest elderly in our communities. We want to work with grateful patients, of course, and grateful carers. And we're looking to build on the strength of the collaboration between all our institutions here and really leverage the expertise of gerontological care that we have already on the system and that we're growing and educating.
Thank you, Dean Kavanaugh. I want to pause here and pose this question to all of you joining us this morning. Now that you've heard the big picture vision for this initiative and you have an idea of our organizational structure, we want you to ask yourself, in what way are older adults a focus in your clinical practice, department, coursework, or research? How do you see yourself and your work contributing to this vision? Just think about that. Now I'm going to bring Dean Bashir back in. So these are very lofty goals, Dean Bashir. What are your priorities for the next year or two?
So our priorities are to build upon our cutting edge research. You know, we have world-class Alzheimer's research, and we've recently had large grants, but we're trying to build upon that by building a front door. We're going to have a clinic that is multidisciplinary and focused on the needs of the older adults. We're going to work on delivering that in a patient-centered and family-centered way. We're going to be building an educational program so that we have a pathway for future providers to learn about how to care for the older adults. And we're doing this in a multidisciplinary way with physicians, nurse practitioners, and other parts of the community. We're really excited about the idea of having an age-friendly hospital and an age-friendly emergency room. And we are very excited about launching an older adult clinic that will really encompass this and wrap all that we're talking about with a big bow for the new year, because we believe that older adults need their own place to get care. And we are very focused on making sure that we are meeting the needs of the older adult community here in Sacramento and Northern California.
So clearly, by focusing on integrated care across all the settings, this initiative brings value to UC Davis Health. But first, we need to understand all the different pathways that patients move within and throughout the system. So joining us now to share that perspective is Dr. Terry Harvath. She is Senior Director of Strategic Initiatives for the Betty Irene Moore School of Nursing, as well as Director of the Family Caregiving Institute. Dr. Harvath.
Good morning, Rebecca. I'm delighted to be here representing the Clinical Delivery Committee. We've been approaching the work of designing the clinical aspect of this initiative with three main strategies. One is to look at our existing services and seeing how we need to gerontologize them, if you will, or make them more age-friendly and age-informed. We've also been identifying what new services will need to be offered in order to meet the complex needs of older adults. And then we're looking at processes across the continuum of care so that we can make sure that we are connecting older adults and not losing them along the way. And we've referred to this process as addressing the clogs, gaps, and cracks, or those places where older adults get stuck, for example, in our observation unit, where they fall through the cracks following discharge and get lost to follow-up, or where there are gaps in needed services that we need to develop for them. So 2 examples of how we're gerontologizing our work include on the inpatient side, we are becoming a niche certified facility. So what that means is that we have hired a gerontological clinical nurse specialist, Anna Sataki, a PhD student in the School of Nursing, I might add. And she is working with the nursing staff on key units in order to develop their expertise in recognizing what we call geriatric syndromes, or those problems that and clusters of difficult, challenging issues that are important for us to catch early, things like delirium or incontinence or potential for fall. We also, Dr. Katrin Tyler in the emergency department has gotten a grant to make an age-friendly emergency department. And with that, there are nurses who are getting trained, again, to recognize the unique needs of older adults when they come into the emergency department. And of course, one of the most exciting examples is the Midtown Clinic. This is an example of a new service that we are developing. And we've hired 2 geriatricians and 4 advanced practice nurses who will, with a cadre of other interprofessional colleagues, be delivering both comprehensive care for frail older adults with complex needs, but also creating opportunities for consultation so patients can continue to be followed by their primary care provider, but get that expert opinion and that expertise, particularly when there are issues that may not be as familiar to somebody who doesn't have expertise in geriatrics. So we're excited about that. We plan to start seeing patients in there in January. And then that's going to be our soft opening. And then we plan later in the spring to have a more formal large opening after we've gotten our processes down. Finally, what we're looking at is how all of these services are connected and making changes in the electronic health system so that we can monitor our patients and provide the age-friendly care. And what that means is focusing on the 4 M's: what matters, mobility, medications, and mentation, but also so that we can have dashboards so that we can follow those most frail patients across the system and have shared dashboards that we can monitor what our outcomes are for some of these difficult patients. So it's an exciting endeavor. There are many, many people who are involved in contributing their expertise to this, and we just can't wait to start seeing patients and get started.
Thanks so much, Dr. Harvath. You know, you really paint a picture that this is across a vast system, and we are a large academic medical health system. Dean Brashear, how can people get involved?
Oh, well, this is one of the ways they can get involved. There are a variety of initiatives. We have multiple committees, as Dean Kavanaugh showed. You can read the website. You can send us an email with your ideas. You can connect with us about what you want to do in terms of education, clinical deliveries, and research. And you can send us multiple ideas. You know, what happened, how we built this was by bringing together a community, and how we will make it great is by bringing it together a community and continuing to get those ideas of what is really needed. So I am so excited about this initiative. And you know, I think it will really set the stage for bringing together all of the amazing world-class care we have at UC Davis Health for the older adult. So we are welcome everybody's input and ideas. And if there's something you think we should do and we haven't thought of it, please let us know.
All right, and that's a great way to tee up some of the questions. We have some questions coming in. Dean Kavanaugh, I want to ask you first, how do you envision the School of Nursing's role in this initiative, both from a care delivery and an educational perspective?
Thank you, Rebecca. We have a great opportunity in the School of Nursing to really make a major contribution to the care of the elderly, really through the Family Caregiving Institute to begin with. This institute, of course, is already getting local, national, and actually international reputation for building expertise in managing the care of carers and of the people they look after. And this is really important. This is a major change in the way we are doing. So this is something to watch out for. Very exciting things going on. Also, we're trying very much to really change what we do with folks in clinics. We're putting both the carer and the caregiver equally of importance in these clinics. We realize how complicated the care of the elderly is and how dependent some folks are. So these are really important things that the School of Nursing are being involved in. We're also, of course, as our major mission, is very interested in developing the next range, nurse practitioners and PAs that are going to be coming into our system, as well as building out the research that we're doing. So the School of Nursing really has a lot to do in those areas. And it's a very exciting time where we're reaching out, not just through the clinic, building it from the ground up almost, but also spreading the ideas right across the health system.
Great. And the carers you're talking about, obviously the Family Caregiving Institute at the School of Nursing will be playing a role. I have a question here for FCI Director Terry Harvath. I'm going to pitch this one to you, Dr. Harvath. What efforts will be addressing prevention in the senior population to support the concept of compression of morbidity published by Jim Fries at Stanford decades ago?
Boy, I'm not familiar with that particular citation. I'm going to have to look it up. But I think part of what we want to do is to not just address the care issues that come up for older adults, but also anticipate what they are. And part of that comes from the part of the age-friendly initiative on what matters. And so when we do intake on patients in the Midtown Clinic, one of the first conversations that we want to have with the patients who are seen there and their family caregivers is what is important? What are the things that contribute to their quality of life without which they would be less satisfied with their lives? And we're going to use that information to really direct our efforts so that we are preserving the functional status. Function is so important for older adults, but also preserving their autonomy and their quality of life, because I think those are really the three important pillars to good care for older adults. So we're going to be looking at what their gait is to make sure that if they are at risk for falls, that we intervene early to try and prevent that from happening. We're going to be monitoring them for early signs of cognitive impairment, because some of those things, if we adjust medications or intervene around other illness issues, we can resolve some of that. So we're really going to look at the kinds of health screening that help us anticipate those geriatric syndromes that can interfere with quality of life.
Okay, thank you. Dr. Brashear, any research being done right now on the social isolation impact of COVID, or is that something you see this initiative being able to tackle?
That's such an important question, because in COVID, older adults are possibly home alone, and also they're just much more isolated from their families. They don't have people coming in. There's a lot less social connection. We know from pre-COVID days that individuals who are older adults who have hearing, eyesight, and other issues in terms of communication also suffer. So I think the important point here is to make sure that we're looking at the entire person as part of this initiative. And in COVID, the social support from the community is even more important. How to deliver that is going to be something to think about. But of course, UC Davis has a robust telemedicine program. So this initiative brings together all the strengths of UC Davis School of Medicine, UC Davis Health, and UC Davis School of Nursing together to really deliver what the older adult needs. And COVID has put a bright light on all of those needs.
Okay, well, I've got you. I have a Medicare related question. Obviously, there are financial limitations for those covered by Medicare. To improve senior access to UC Davis Health, will they be participating in Medicare Advantage plans other than those offered for select groups? Has this been discussed?
So UC Davis Health is committed to providing care to the community. We're going to take that information back. We have multiple plans that we participate in, and of course, we are exploring all the opportunities to care for individuals in our older individuals in our community. So this is designed to be an inclusive program. So we'll take that specific question back and make sure we've got that box checked.
Okay, yeah, we're getting a lot of good questions. I'll just throw this out to the panel to see who wants to take this one. Can undergraduates get involved in such as like human development majors? Will there be a way for undergraduates to get involved?
I'll take a first stab at that. One of the things that we are building into this initiative from the very beginning is creating dedicated education units. So we want, for example, at the Midtown Clinic, for a variety of learners to be involved in the care there. That's how we attract health professionals into careers in caring for older adults. And so we want to be sure to give them opportunities as well. And I think we would be very open to exploring with our colleagues on the main campus ways to include students in some of that outreach for older adults, perhaps some of the programs that we might want to develop to combat the social isolation that will likely be with us for a while, even as the vaccine for the COVID-19 flu rolls out. So yes, I think we want to be sure to include students and to create that pipeline of interest in careers caring for older adults.
So Dr. Harbath, you mentioned the new clinic, obviously, for those visits, but have there been any discussions about home visits as well as part of this continuity of care?
Yes, absolutely. I think that it's really important for us to see how older adults are functioning in their own environments, because we get a really skewed picture when we see them in the hospital, in the emergency department, even in the clinic, because we know that environment is so important to the functional status and to the cognitive status for older adults. And so we certainly see that there will be opportunities for our clinicians, for our students to make home visits, to do that assessment, to really understand how this person and their family are managing in the home environment. This past summer in the School of Nursing, as some of you know, we've got a 1-bedroom apartment in the school that we use for learning for our students for simulation. And we developed some COVID sensitive simulations for students so that they can understand how it is they need to safely enter the home of an older adult, maintaining distance, masking, face shields, that sort of thing, to provide care and assess what's going on in the home.
Thanks. Dean Kavanaugh, how will we include underserved populations of older adults, those who are unsheltered, maybe those English is not a first language?
Thank you. As many people will know, the importance of reaching our communities and underserved is central to everything that we do at UC Davis Health. And I think the issue that your question raises is really important to us. It's the same things that we deal with Aggie Square. And I think at this point, we're trying to find the best ways to engage our communities. Part of that may be through consultation groups. But at this point, we're trying to build the infrastructure, which will include discussions with community leaders, and how best to reach those people who can most benefit from the services we plan to offer.
So are seniors involved, or will they be involved in this planning process?
As a question to me, absolutely. I think part of the success of this clinic will be not just that it's innovative, not just that it's being built from the ground up, but it involves those people who take most interest in that. And that is going to be the older folks themselves and the caregivers. And so at some point, there will be an opportunity when the clinic actually finally gets launched to think carefully about how we best engage our communities, our patients, their caregivers, to really tailor, and that's really important for us, tailor what we offer to our older people in our community right now.
Thank you, Dean Kavanaugh. Dean Brashear, why is an integrated approach so important in dealing with this population? And what does that look like in the clinic? What type of services and specialists will be within this one-stop front door?
Well, we know that integrated care really delivers the best care, and that brings all the different skill sets of nursing, um, physicians, physical therapists, speech therapists, and the Caregiver Institute, bringing all those together. I can see lots of opportunities where in the clinic, people will be assessed by different personnel. For example, you mentioned isolation, cognitive tests, hearing, vision, all the things that affect older adults and that interfere with their ability to stay independent and healthy in their community. So I can see a multidisciplinary approach, and we have known from a long time ago in medicine that a multidisciplinary approach is best, and that's why this initiative is so important, because it is truly a multidisciplinary approach in all areas: education, research, and community engagement.
I know we got a little sneak peek of the clinic space with Dr. Harvath. If you're watching, you can actually see that on the aging website, which we'll share with you before we conclude. There's even a gate hallway where to actually monitor the gait, because we know that if there's difficulty walking, that may indicate something else. Someone is asking, have we considered including alternative therapies in our program? Dean Brashear, is that something that's been discussed?
You know, that's been discussed, but I think it merits further exploration. We've been trying to get the clinic open and been a little bit delayed from COVID, but we'll put that on the list, because alternative therapies do offer other ways to mitigate some of the effects of aging. We want to avoid pills if we can, and we want to make sure that all of the treatments have the least side effects. So I think that's an excellent point, and one that we'll take back to our work groups.
Great. And I'll ask you one more question, Dean Brashear. In terms of research, what does focusing on this older population mean as far as clinical trial opportunities?
So there's a variety of clinical trial opportunities about aging, but also for individuals with mild cognitive impairment. So people who just have mild memory problems, but don't have any interference in their activities of daily living. That's actually where the research is going, is trying to figure out how to intervene in that area. And UC Davis already has some large trials. One is on exercise and how that affects mild cognitive impairment. And we just also had a large NIH grant to Dr. DeCarli to look at changes on MRI scans. So, you know, I think that the outpouring that we've had from the community with COVID is a sign that our community is very engaged in participating in the research of UC Davis School of Medicine, the UC Davis School of Nursing. And so this is another way that the older community can participate in research. And I just am such a big fan of clinical trials. I know my own mother-in-law participated in a clinical trial. And I think our families and our communities, it's an untapped opportunity for everyone.
All right, we will have to close it there. We are now at 8:30. We want to thank everyone so much for joining us. Here are our support staff who are eager to hear from you. If you have any questions, you can also log on to the website, health.ucdavis.edu/aging. We are recording this. We will follow up with it. And if any of your colleagues were not able to join us, we encourage you to encourage them to tune in today at 5:15. We will have another town hall where we will get another group of questions and continue to roll out the news. But until then, thank you so much for joining us. We hope you have a great day.